Troubling report recently issued by the Justice Department's Inspector General regarding the deaths of incarcerated individuals in the Federal Bureau of Prisons. I welcome Director Peters and Inspector General Horowitz back to the committee. In recent years, more than 300 people have died of unnatural causes in custody of the Bureau of Prisons, deaths that too often have been the result of mismanagement and operational failures. An investigation by the Marshall Project and National Public Radio 3 years ago found that the Thompson Federal Prison in my home state of Illinois had become one of the deadliest prisons in America because of the now defunct Special Management Unit. I was shaken by the allegations in that article and immediately asked Inspector General Horowitz to examine them. We will discuss the results today. After media reports late last year alleged that some adults in custody died while waiting for necessary medical care, I called on BOP to change its procedures, staff, and supply medical units so that incarcerated individuals could receive the care they needed. It is evident that many of the issues the committee has highlighted over the years, including understaffing, overuse of restrictive housing, and employee misconduct, will continue to have deadly consequences if they go unaddressed. The Inspector General's report identified 344 non-medical deaths of adults in custody in its review period 2014 to 2021. A number of trends emerged that demonstrated increased risks to safety of individuals in BOP care. For example, 20% of these deaths were overdoses from contraband and prescription drugs. BOP continues to struggle with contraband interdiction and lacks adequate treatment for thousands of individuals fighting addiction. Understaffing, particularly in health and psychology services, strains their ability to provide quality care. Violations of BOP policy by staff, quote, present significant barriers to the BOP's ability to ensure institutional safety. This afternoon, my colleague Senator Booker, chair of the Criminal Justice Subcommittee, will hold a specific hearing on prison staffing crisis. I thank him for his leadership. BOP's lengthy and ineffective discipline process fails to bring accountability for staff misconduct, and BOP consistently fails to use post-death reviews and proper record keeping to identify corrective actions. This failure to learn from past mistakes is most troubling when examining the role of restrictive housing in custodial deaths. Suicides accounted for just over half of the 344 deaths CIG reviewed. Almost half of those suicides occurred in restrictive housing, which is more commonly known as solitary confinement. We have a stark reality when it comes to solitary confinement. This is cruel and unusual punishment that has been the norm in the United States for way too long. In 2012, I held the first ever congressional hearing on solitary confinement. At the time, nearly 8% of federally incarcerated individuals were in restrictive housing. After some progress under President Obama, we've returned to roughly the same percentage of people in solitary today. We know that overuse of solitary confinement causes lasting, irreparable, physical, emotional, and mental harm to incarcerated people. Moreover, it threatens public safety and strains prison budgets. I want to add, too, parenthetically, I understand some of the individuals we're talking about are dangerous people who need to be isolated under certain circumstances. I'm a realist about that. But this consistent reference of 8% is unacceptable. Earlier this month, the General Accounting Office released a report, which I requested with Senator Coons. It found that the Bureau of Prisons has failed to implement 54 of the 87 recommendations from 2 prior studies on restrictive housing. Let's be clear. The failure to decrease our over-reliance on restrictive housing is deadly. Deadly. That is why I held a follow-up hearing on the dangers this spring. Director Peters, I understand many issues we're discussing today have been problems for years, long before you arrived. But it's time for solutions and change. The lives of hundreds of Americans in Bureau of Prisons custody are at risk. My colleague, Ranking Member Senator Graham, is under the weather today and won't be able to join us this morning. And Senator Grassley was here momentarily to acknowledge the opening of this committee meeting. He has another conflict in his schedule as well, but I want to proceed. We're going to have swear in the witnesses. Each will have 5 minutes to provide an opening statement, then rounds of questions for each senator present of at least 5 minutes. So I ask individuals, please stand. Raise your right hand. Do you affirm the testimony you're about to give before the committee will be the truth, the whole truth, and nothing but the truth, so help you God? Let the record reflect that both have answered in the alternative, in the affirmative, I should say. And we'll start with Inspector General Horowitz. You may proceed.